about what is pediatric surgery and what are the differences, anatomical and the physiological differences between the adults and the children. What are the pre-operative evaluation in the children? What are the anesthesia management, and what surgery is preferred in the pediatrics, and what are the ethics for the future technologies. So these are our learning objectives. So let's start with the first one. So what is the pediatric surgery? So it is the medical specialty that focus on the surgical management of infants, children or the adults up to the 18 years of age.
Up to 18,
And some health sectors it is up to the 21 years of age.
Some health sectors.
Yes.
Some.
And
good old days it was only 15 years.
yes.
Pediatric medical.
Yes, sir.
Maybe 18 हो गए.
Yes.
According to WHO.
Yes, sir.
21 तक.
Yes, sir.
तो आप
In
लोग
some
21
health
के हैं?
sectors, sir.
आप लोग 21 के हैं कि नहीं?
Up to 18.
या ऊपर के हैं?
ज़्यादा क्या सर?
ज़्यादा के हैं?
And sir, it mostly treat the congenital disorders or the different types of specific diseases or the injuries.
जिस तरह हाइड्रोसील हर्निया बच्चों में क्या है? ये congenital disorders.
Congenital disorders.
Acquired नहीं है ये.
So let's discuss about the what is pediatric anatomy and the physiological differences. So as the children's size is very small and the proportional or dimensions are also small, and the organ development is also going on in the pediatrics, like the liver, kidney and the lungs are not mature at the birth. So these are mostly at concern, and bone development is also going on in the children. So it is important in the orthopedic surgeries. Dental development is also going on. It is most important in the maxillofacial surgeries. Then the immune system is not developed in the children. They are very prone to the infection. And next is the respiratory system and the cardiovascular system. It is also the change as compared to the adults. Their respiratory rate, their blood pressure is different as compared to the adults. Next is the nervous system. This is also not developed and developing there, and children also cannot regulate their temperature. So thermoregulation is very necessary. Patient may go into the hypothermic condition. Then the body water composition is also necessary. They may go into the dehydration condition. These are the basic pediatric and the anatomic and physiological differences.
So what were the main points here? Physiology of an adult and physiology of an infant is totally different in terms of their size, in terms of their organ development, in terms of their physiological reserves, blood volume, you see, and temperature regulation. Things are totally different. So you cannot manage adult patients, and you cannot manage pediatric patients as adult patients, like them. And you have to keep a very close eye on these things, especially this one, hypothermia children, because hypothermia leads to metabolic acidosis and then leads to lactic acidosis, leads to coagulopathies and then bleeding disorders.
And then the pre-operative evaluation and the preparation is necessary. So first of all, fasting conditions, which is the 2-4-6 rule, and 2 hours for the simple water or the liquids, 4 hours for the breast milk, and the 6 hours for the solid foods. Next is the liquids or water.
If the baby has to be fasted only for
2 hours. For liquid water.
Then 4 hours for the breast milk. If the
अगर
breast
baby
milk,
ने breast milk में तो 4 hours
and if you on the solid food, then the 6
अगर
hours.
कोई मीठी या कोई पाउडर वगैरह बाहर से खिलाया तो
6 hours.
6 hours या कोई बनाने खिलाया तो 6 hours तक पेशेंट को क्या करना है?
And
एम्प्टी हो रखना है.
then these patients are first on the OT list because they cannot bear on the fasting.
Another
Then the child-friendly environment is created for the patient to avoid the distractions and make it comfortable. Next, the collaborative care is necessary, like the multidisciplinary approach is necessary, and we will call the pediatric surgeon, pediatrics, anesthesiologist, cardiologist, and etc. Then the family-centered care is also important. We will involve the family and tell about the pros and cons, the risks and benefits. Then the emotional support is necessary to the family because they are in the stressful condition. So we will keep them calm and we will counsel
keep them
them.
updated and informed about
Yes.
right? If someone's 1-year child is being operated upon, you can imagine the gravity of situation in terms of their, sympathies towards their child. He is about to be operated upon, he is being, surgically fixed. So ये तो जब पेरेंट्स होंगे पता चल जाएगा यार बच्चा ऑपरेशन थिएटर जब तक नहीं निकलता है आपकी दुनिया डिफरेंट होती है. दिस इज वेरी इंपॉर्टेंट पॉइंट.
Yes.
The family centered care, ठीक है, you have to take them on board.
Next, let's talk about the anesthesia in the pediatric surgery. So anesthesia is depend upon the age and the size of the patient because anesthesia dose varies and their organs are, as we already discussed, immature. They cannot metabolize the drugs or the excrete. So there may be the emergence or the recovery period may be prolonged in the children. And there is airway management is also necessary because they have a narrow airway. So we will monitor them. Then the IV access in the children is very difficult because they cannot cooperate. Next, the temperature regulation because during the anesthesia, children may go into the hypothermia. Then the proper positioning of the children is necessary because their bones are soft. They may be compressed or the nerve may be compressed. And then the special training in the pediatrics is also necessary. Next, the different surgical instruments varies in the pediatric surgery, like the pediatric forceps, needle holders, and the different types of pediatric laparoscopes are also present. And pediatric varus needle is present. Pediatric endoscopes or the biopsy needles are designed. Next, the pediatric anesthesia machine is also different. Then the pediatric endoscope, pediatric positional devices like the cushions, and pediatric imaging equipments like the small ultrasound probes. Then the orthopedic instruments are also different. Cardiac instruments, vascular clamps, like that.
So pediatric patients, small instruments.
Yes, sir.
Generally, you cannot manage them with a device retractor. You put in small pediatric instruments.
Next, the preferred surgery in the pediatrics is the minimal invasive surgery because this is very safe and the specialized training is necessary because the anatomical differences. Next, the proper sterilization is also necessary for the safety protocols and the perioperative fluid and electrolyte management is also necessary. So minimal invasive surgery benefits are that this reduce the hospital stay, increase the recovery, and also it has a less complication and the better cosmetic outcomes. Next, some of the common pediatric surgeries which are performed in the surgical departments.
How many pediatric surgeries you have seen so far?
Can anyone know?
Can anyone open question? Specific question.
Amna, can you please tell me about which pediatric surgery performed in our
You have seen
surgical
so far. Number one. Any other? Cardiopexis. Hydrocele.
Hydrocele.
And umbilical hernia.
Yes.
Needed homeopathy. Okay, so commonly we operated upon hydrocele hernia in undescended testes.
Under duty.
Undescended testes. Right. So this is the pediatric surgery. So
first is the most common surgery performed in the pediatrics is the appendectomy for the acute appendicitis, hernia repair for the inguinal hernias, different types of circumcisions. Then if we talk about the ENT surgeries, tonsillectomy or the adenectomy. Then the cleft palate is a congenital disorder, it's very common. Then if we talk about the cardiac surgeries, it may be performed for the congenital disorders like the ASD, VSD, tetralogy of palate. Then the orthopedic surgeries are performed for the clubfoot or the scoliosis surgeries. Then the GIT surgeries for the congenital disorders or tracheoesophageal repair. Then the urological surgeries about the undescended testes or orchidopexy. Then the neurological for the hydrocephalus or the different types of brain tumors.
आपने देखो हाइड्रोकैफ के बच्चों को ऑपरेट करते हैं, शंट डालते हैं, वेंट्रिकुलर.
So these are some of the common pediatric surgical conditions. This is the inguinal scrotal swelling. It may be the hydrocele or the inguinal hernia comes. Next, this is the hypospadias. Then third picture is the
This is not hypo, this is phimosis.
phimosis. Sorry.
लोग
This
स्पेशली
is the
हमें लगता
Yes,
है
sir.
जब हमने रिट्रैक्ट करके देखा तो he had like this.
Yes, sir.
ये तो कुछ सीवियर फॉर्म का है लेकिन
Yes.
वो इतना सीवियर नहीं था.
Mental images.
So this is mild form of hypospadias जिसको आप क्या कहते हैं? सबकोरोनल भी कहते हैं या सबकोरोनल और सबसल्कल हाइपोस्पेडिया कहते हैं. ये कोई इतना खास फर्क नहीं पड़ता है.
Yes.
ठीक है. अगर ये पेनाइल हो और पेरिनियल हो तो देन इट्स डिफिकल्ट. क्योंकि फिर बाद में फर्टिलिटी के इश्यूज बनते हैं. यहाँ इट डजंट मेक डिफरेंस. So these are the common pediatric surgical conditions.
Next, this is some of the congenital malformation like the tracheoesophageal fistula, and it has a left-sided diaphragmatic hernia. Next, this is the mucous diverticulum containing the gastric mucosa, and this is the gastroschisis in which the gut is
Kisses.
gastrokisses, and mid gut is the prolapse from the near the umbilical region, and this is the pedunculated juvenile polyp, and this is the double colon with the double appendix. This is the congenital disorder.
I have operated upon these patients frequently when I was doing my postgraduate training. Exemplus major, exemplus minor congenital disorders, and this meant intestine lies out, liver lies out.
Then what are the ethics in the pediatric surgery? So we will give the proper informed consent from the family or the attendants tells about the risk and benefits, and we will also give the psychological support we have already discussed. Pain management, post-operative pain management is also necessary because the comfort of the children and the comfort of the family. So the surgeon should consider the long-term impact of the surgery before doing any surgery, and they minimize the risk during the surgery and the post-operatively. Then the multidisciplinary approach is necessary in the ethics, and the confidentiality and the privacy is also important.
What do you mean by confidentiality and privacy in terms of ethics? Ethics is together.
So, for example, the patient is having the orchidopexy, or example, we're not able to tell a whole the family that he is having a testicle
If someone has got absent testes,
Yes, sir.
current orchidism, and you did it, you are not supposed to, कादिर पटेल की तरह उसकी जो है इमरान खान की स्टेटमेंट को लाके प्रेस कॉन्फ्रेंस में आप ये कहने दिस रोड क्या एथिकल और उस पे जनाब वाले केस में इतने यूरिन में पास से सिफिलिस आ रहा था तो गोनोरिया हो गया तो एड्स हो गई, इस तरह की बातें. दिस इज प्रोफेशनल, दिस अनएथिकल. इज अकाउंटेबिलिटी शुड बी देयर इन क्राइम. तो आपने पेशेंट के जो कैरेक्टर डिसऑर्डर्स हैं, ठीक है, और किसी को ASD है, BSD है, यू आर नॉट सपोज्ड टू, ठीक है, एट द कॉस्ट ऑफ इवन योर लाइफ. अगर गन पॉइंट पे भी कोई आपको बताए कि यार ये आप नहीं करेंगे, ये मुझे जो है ना मेरा प्रोफेशन ये नहीं सिखाता. And multidisciplinary team collaboration, pediatric surgeon, pediatrician, anesthetist, and psychological support, family support. When you are involving all of them on board, and you are making a plan for post-operative recovery, this is known as multidisciplinary collaboration. So many people are involved.
So at last, what are the future trends or the advances in the pediatric surgery? So in now, minimal invasive robotic surgery is also performing in the world. Next, the image guiding surgeries like the CT scan guided or the MRI guided surgeries. Then the surgical stimulation and the VR surgeries for the different types of congenital disorders. Single incision laparoscopic surgery is also performed. Then the transplantation innovations are also going on, in which the living donor liver transplantation done, and the minimal invasive kidney transplantation. Next, the non-invasive prenatal diagnosis or the fetal surgery for the congenital disorders. Then the tissue engineering and the regenerative medicines also for the congenital disorders. Nanotechnology in the drug delivery, in which we will give the target therapy which will affect and reduce the systemic effects. Then the telemedicine or the teleconsultation, which will remote access to the patient to the underserved areas. Then the hybrid operating rooms are also designed, in which the latest advanced radiological surgical instruments and with the combined catheter-based interventions are also performed.
So what do you mean by hybrid operating rooms?
Sorry.
This is our conventional operation theatre, where only we do cutting and repairing. But if you transform operation theatres into sort of some other discipline is basically involved, like you want to do ultrasound guided drainage of an abscess, right, and it is directly being monitored on the screen, there will be kind of hybrid operation theatre. You want to do drug deliveries directly into the tumor, for example, if it is hepatocellular carcinoma and you want to give them transarterial embolization. You want to block the blood supply to that particular tumor, or you want to deliver medications directly into the tumor. So you will go to the femoral artery, then aorta, then into the celiac trunk, and then into the hepatic artery, and then go to that particular branch, and you will inject the medication through that feeding artery into the tumor. So that the drug will locally act, and that will be shattered or it will be destroyed. Nanotechnology delivery is kind of there. And single incision laparoscopic surgery means we insert four, 10, 10 and 5, 5.
Yes, sir.
But there are some ports available. You will insert it into the umbilicus in a single port, and there are 4 holes. Port is one,
Yes, sir.
but that port has got
Four
four holes
sub
or 3
holes.
holes. So you will, and the instruments are specially devised. They have got the ability to move like this. In our instruments, we can only do
Cutting.
2-way, opening and closing, double action. Double action or single action forceps are here available with us. But in single port laparoscopic surgery, these double action and single action instruments do also have a wrist, so that you can easily move. Otherwise, you cannot, all the instruments are in one direction, you cannot do that. So this is known as single port or single incision laparoscopic surgeries.
So that's it. Thank you.
Okay, very good, shabash. Chalo collect करें इसके लिए. Okay, let's collect for him.
Yes.